Americans of all political persuasions are coming to the sad realization that our First Lady is a congenital liar. William Safire, Blizzard of Lies, The New York Times. The first word I had in mind was prevaricator, which means liar. And the second one was dissembler, which also means liar.
Barack Obama still won't agree to debate in Wisconsin, and now he's hiding behind false attack ads. Maybe he doesn't want to explain why his health care plan leaves out 15 million people and Hillary's covers everyone.
Hillary Clinton's lies. 1. Mrs. Clinton fails to tell you that she and Obama already debated their health care differences. 2. Mrs. Clinton fails to tell you that her health care plan purportedly covers all people by forcing people who don't want her plan to buy it.
On healthcare, even Bill Clinton's own labor secretary says Obama covers more people than Hillary and does more to cut costs, saving $2,500 for the typical family.
Let's look at health care, another contrast between you and Senator Obama. He's been pressing that case this weekend. The key difference, as you point out, is you would require everyone to have health insurance. You believe that will get to universal coverage. He would not. Here's what Senator Obama said about that in the debate.
You can mandate it, but there's still going to be people who can't afford it. And if they cannot afford it, then the question is, what are you going to do about it? Are you going to fine them? Are you going to garnish their wages?
You didn't get the chance to answer that question in the debate. What is the answer to those two questions? Will you have fines for people who don't buy health care, don't go by the mandate? Will you garnish their wages?
With respect to how do you get people to do it, I find this somewhat bewildering. About 20% of the people who don't have health insurance in America today could well afford it, even at the cost that it is, which is exorbitant. So what we've got to do is have shared responsibility. Everybody has to pay something.
Let me interrupt you there, because the other night at the debate you said that you and Senator Edwards bit the bullet on this question of mandates. And Senator Edwards was quite clear in his plan. He said if people still didn't buy the insurance, their wages would be garnished. And I still haven't heard. If people can afford it and they don't buy the insurance, will their wages be garnished under your plan? And a lot of independent healthcare experts, many who worked with you in 1994, say that without these enforcement mechanisms, you simply can't get to universal coverage. You can't claim to have universal coverage, so there's no difference between your plan and Senator Obama's. And I mean, you talked about automatic enrollment. Will you garnish wages of people who don't comply, don't buy the insurance?
George, we will have an enforcement mechanism, whether it's that or it's some other mechanism through the tax system or automatic enrollments. But you're missing, I believe, the key point. If you don't do what I am saying we do, we will never even attempt to get to universal health care. And the reason why I think there are a number of mechanisms, going after people's wages, automatic enrollment, when you are at the place of employment, you will be automatically enrolled. Whatever the mechanism is not as important as commitment to universal health care.
My 2 cents worth, and I think it is the 2 cents worth of everybody who worked for the Clinton administration health care reform effort of 1993 to 1994, is that Hillary Rodham Clinton needs to be kept very far away from the White House for the rest of her life. Heading up health care reform was the only major administrative job she has ever tried to do, and she was a complete flop at it. She had neither the grasp of policy substance, the managerial skills, nor the political smarts to do the job she was then given. and she wasn't smart enough to realize that she was in over her head and had to get out of the healthcare czar role quickly. There is no reason to think that she would be anything but an abysmal president. J. Bradford DeLong, Professor of Economics, Berkeley. Clinton administration veteran.